So in the radiology department, a patient could turn up and the patient is so obese. So how could you actually handle such a patient? So working effectively with an obese patient in radiology. Okay, so let's look at this. So it's a normal patient. This is a patient that is so obese. Of course, obese patients, handling them for imaging is also hard. Then also, how will I put it? Handling them for imaging is hard. Then also, you trying to interpret the images you get to is also hard. Do you understand? So key challenges is equipment limitation. So sometimes the tables and scanners may have weight limits. So sometimes you're afraid of putting the obese patient on those equipments. So larger body habitus can exceed the gantry size or reduce the image quality. The image quality issue. So there's increased soft tissue thickness. So you can scatter the radiation and reduce the contrast. I seen this. I can see the muscles. I can see the organs well. I can see the skeletons very well. You get. So what next? Longer exposure times may be required, and this is now placing the patient at the risk of having side effects due to radiation. So patient comfort and dignity, the patient is not really comfortable too. Now, best practices for radiographers is you have to communicate well, and you don't have to be biased. So use respectful, non-judgmental languages. Okay, explain the procedures very clearly to the patient each time. Then allow the patient extra time for them to be able to move their body and position very well. So technical adjustments, of course, for the obese patients, you have to readjust the x-rays and all those exposure, and for them they have to be higher. Use grids and advanced imaging techniques to reduce scattering. So use things that you can be able to now focus the radiation energy to a particular place. Then ensure that the equipment can safely accommodate the patient weight, because you don't want the equipment to scatter and you're having some other orthopedic issues coming in. So other impact on patient care is obese patients often face barriers to diagnostic imaging, and this can usually delay the decision making they have. Do you understand? Decision making that the medical professionals have to make as regards to them. That's final diagnosis and the rest of it. So this is the considerations if you are working with an obese patient in radiography.